Every day you choose to move your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement. As we reach our 60s and beyond, our legs may no longer feel as strong or steady as they once did. Many people begin to notice knee pain, stiffness, or difficulty standing up and walking with confidence. But here's the good news. You don't need a gym membership or heavy equipment to regain strength and mobility. With just a sturdy chair, you can start rebuilding your legs safely and comfortably right at home. In today's video, 6 chair exercises to relieve knee pain and strengthen legs. After 60, you'll learn 6 simple yet highly effective movements designed to ease knee pain, boost leg strength, and improve balance in just 15 to 20 minutes a day. Each exercise can be easily adapted to your ability level, helping you move with less pain and more freedom. If you find this video helpful, don't forget to like, share, and subscribe to our channel for more easy science-backed exercises made for older adults. And make sure to check out the other videos in this playlist. Each one is designed to help you stay strong, mobile, and independent for years to come. Let's get started together. Comprehending the biomechanics of knee wellness. Prior to engaging in the workouts, it is beneficial to understand the mechanics of the knee. The knee is the largest joint in the body, classified as a synovial hinge joint, comprising the femur tibia and patella. The stability derives not alone from the bones, but also from ligaments, tendons, cartilage, and importantly, the surrounding muscles. Maintaining balanced and conditioned muscles enables the knee to absorb forces, facilitate smooth movement, and adapt to unforeseen alterations in terrain. Essential muscle groups that influence knee health comprise the quadriceps, a group of 4 muscles located at the anterior aspect of the thigh responsible for knee extension. They function as inherent shock absorbers. During walking, running, or descending stairs, the quadriceps contract to decelerate the body and absorb impact pressures that would otherwise affect the knee cartilage. Inadequate quadriceps strength is a significant contributor to knee discomfort and instability. The hamstrings, a trio of muscles located at the posterior aspect of the thigh that facilitate knee flexion and hip extension. Constricted hamstrings can retract the tibia, alter knee alignment, and elevate stress on the patella. They also contribute to the deceleration or stabilization of the knee during movement. The gluteal muscles, the gluteus maximus, medius, and minimus, are essential for hip stability. Inadequate strength in the gluteus medius can result in pelvic tilt and inward knee collapse, knee valgus during movement, hence exerting stress on the internal structures of the knee. The calf muscles, gastrocnemius and soleus, regulate ankle movement, assist in absorbing ground response forces, and enhance proprioception, your awareness of body position in space, crucial for maintaining balance. The adductors and abductors are muscles located on the inner and outer thigh that stabilize the pelvis and regulate lateral leg movement, hence assisting in maintaining knee alignment. Chair-based exercises are effective as they enable a safe and regulated emphasis on these muscles. By diminishing balancing requirements and decreasing the burden of full body weight, they facilitate the acquisition of correct form and muscular activation, establishing a foundation for more strenuous weight-bearing activities in the future. Consider the knee as a tent pole for a clear metaphor. The bones serve as the framework, while the muscles and tendons represented by the ropes and pegs maintain stability and prevent instability. Reinforcing and synchronizing these ropes enhances the overall reliability of the construction. Warm-up, readying the body. A concise warm-up enhances blood circulation, elevates muscle temperature, and prepares joints for activity. Warm-ups need not be lengthy or arduous. A duration of 5 to 8 minutes suffices. Proposed warm-up. Perform sitting marching, 1 to 2 minutes, alternately elevating knees at a moderate tempo. Perform gentle ankle circles, 10 repetitions in each direction for each foot. Hip marches with contralateral arm swings. If safe, use modest opposite arm movements to promote spinal rotation. Torso twists. Maintain an upright posture and gradually rotate the upper body laterally 8 to 10 times to facilitate spinal mobility. These movements alleviate stiffness and facilitate the primary exercises. In the presence of joint swelling or considerable morning stiffness, an extended warm-up period or the application of mild heat, such as a warm shower or heat pack, may be beneficial. The 6 fundamental chair exercises. Presented above are 6 exercises that constitute a comprehensive regimen for strength and flexibility. It is advisable to perform the set 3 to 5 times weekly, attuning to your body and ceasing any exercise that induces acute or exacerbating pain. Consult your physician or a physical therapist prior to commencing if you have pre-existing medical conditions or recent injuries. Exercise 1, seated knee extension. Primary objective: isolate and fortify the quadriceps, the principal stabilizers and stress absorbers of the knee. Anatomical focus. This targets the 4 quadriceps muscles: rectus, femoris, vastus, lateralis, vastus medialis, and vastus intermedius. The vastus medialis, a teardrop-shaped muscle located near the inner knee, is crucial for ensuring adequate tracking of the kneecap and can alleviate specific types of anterior knee discomfort. Biomechanical advantages. Robust quadriceps effectively absorb impact during ambulation and stair descent, thereby diminishing compressive and shear pressures on the knee's cartilage and associated tissues. They offer dynamic stability, functioning similarly to a natural brace that compensates for lax ligaments or age-associated joint alterations. Instructions for execution. 1. Position yourself on a robust armless chair with your feet resting flat and your knees bent at around 90 degrees. Position yourself at the front of the chair, maintain an erect posture, and refrain from leaning against the backrest. Subtly activate your core by retracting your navel. Rest your hands on your thighs or gently grasp the sides of the chair for stability. 2. Inhale to prepare. Exhale while gradually extending one leg forward until the knee is comfortably straightened. Do not fully extend the knee. Maintain a slight, gentle flexion to safeguard the joint. 3. While extending the leg, elevate your toes towards your shin dorsiflexion to enhance the quadriceps contraction. Maintain this position for 3 to 5 seconds. The anterior portion of your thigh should exhibit tension. 4. Inhale while gradually returning the leg to the initial position with precision. 5. Complete all repetitions on one leg before switching or swap legs with each repetition. Recommendation: 2 to 3 sets of 10 to 12 repetitions per leg. Allow a rest period of 30 to 60 seconds between sets. If you are a novice to exercise, commence with a single set and progressively increase the volume. Frequent errors and their rectifications. Employing momentum. Rapidly elevating the leg diminishes efficacy. Proceed with caution and intention as though propelling your leg through water. Slouching or reclining. As the quadriceps fatigue, individuals frequently arch their backs to compensate. Correction. Maintain an upright posture and reset prior to each repetition. Ensure the core is activated. Knee locking. Hyperextension exerts stress on the joint capsule and ligaments. Correction. Cease just prior to complete lockout. Maintain a small flexion. Advancements and alterations. Simplified. If complete extension causes pain, elevate only to a comfortable height and decrease the duration of the hold. Employ both hands gently on the seat for enhanced support. More challenging. Extend the hold to 10 seconds or use light ankle weights. Begin with 1 to 2 pounds. Extend the descending phase to 3 to 5 seconds to highlight eccentric control. Practical advice. Consider applying pressure to the posterior aspect of the knee against the chair when stretching. That stimulus facilitates the activation of the vastus medialis. Exercise 2, seated soleus push-up, heel elevation. Primary objective: fortify the soleus, a deep calf muscle crucial for posture balance and circulation. The anatomical emphasis on performing heel lifts with bent knees primarily engages the soleus muscle instead of the bigger gastrocnemius. The soleus stabilizes the ankle and facilitates venous return from the legs, so it is often referred to as a second heart. Biomechanical advantages. Robust calf muscles enhance push-off during ambulation and facilitate impact absorption upon landing. Enhanced ankle stability promotes knee stability as the lower limb functions as a cohesive chain. Engaging the calf pump enhances circulation, potentially alleviating leg edema and sensations of heaviness. Instructions for execution. 1. Maintain an upright posture with your back straight, feet flat and hip width apart and knees positioned at a 90-degree angle. 2. Maintain the balls of your feet on the ground and gradually elevate both heels to a comfortable height. The motion should originate from the ankle. 3. Pause at the apex for 1 to 2 seconds to experience the contraction of the calf muscle. 4. Gradually and methodically lower the heels. 5. Reiterate for the collection. Recommendation: perform 2 to 3 sets of 15 to 20 repetitions with a 30-second rest interval between sets. If your ankles are weak, commence with a reduced number of repetitions and gradually increase. Frequent errors and their rectifications. Bouncing or rushing. Rapid repetitions utilize tendon elasticity rather than muscular strength. Correction: halt at the apex and regulate the descent to maintain muscular engagement. Leaning forward or backward alters the mechanics of rocking. Correction: maintain a stable and upright torso. Advancements and alterations. Simplified. Begin with 10 to 12 repetitions, or perform single-leg heel rises to minimize exertion. Increased difficulty. Apply gentle pressure on your thighs while lifting for more resistance, or position a lightweight object such as a compact book or bag on your lap. An alternative is to maintain the apex position for an extended duration of 3 to 5 seconds. Practical advice. Envision adhering a strip of tape beneath your toes to the floor while lifting. This can enhance toe control and diminish the inclination to grasp the floor with your toes. Exercise 3 pillow squeeze isometric adduction. Primary objective: fortify the adductor muscles of the inner thigh to enhance pelvic stability and avert inward knee collapse. This isometric squeeze specifically targets the adductor group comprising the adductor longus brevis, magnus pectineus, and gracilis, which draw the legs toward the body's midline and collaborate with the outer thigh muscles to support the pelvis. Biomechanical advantages. Insufficient adductor strength may result in pelvic instability and knee valgus, inward knee displacement, hence exerting stress on the medial collateral ligament and medial meniscus. Fortifying the inner thighs aids in maintaining knee alignment and enhances gait. Instructions for execution. 1. Maintain an upright posture with feet positioned flat and knees at a 90-degree angle. 2. Position a small pliable object such as a cushion-wrapped towel or foam ball between your knees. 3. Exhale and apply a gentle squeeze to the object, exerting around 50–70% of your strength. 4. Maintain the compression for 5 to 10 seconds while breathing normally. 5. Inhale, then exhale gradually, wait and repeat. Prescription 2 to 3 sets of 10 repetitions each, sustained for 5 to 10 seconds. Advance by augmenting hold duration or repetition count as strength enhances. Frequent errors and their rectifications. Applying excessive pressure or speed. An abrupt, forceful squeeze is less advantageous and may be disruptive. Adjust pressure incrementally, maintain consistently, and discharge gently. Breath holding. Numerous individuals instinctively cease respiration during isometric exercises, potentially elevating blood pressure. Correction. Maintain continuous breathing. Exhale throughout the contraction if beneficial. Suboptimal posture. Slouching undermines core engagement. Correction. Maintain an upright posture with relaxed shoulders and a subtly engaged core. Advancements and alterations. Simplified. Utilize a more pliable object or reduce the duration of the grip to 2 to 3 seconds. More challenging. Extend the hold duration to 15 to 20 seconds or utilize a more rigid object, e.g., a yoga block or a half-deflated playground ball. A resistance band positioned above both knees can be compressed inward to increase strain. Practical advice. Integrate the squeeze with a minor pelvic tilt or an abdominal draw-in to enhance the connection between inner thigh strength and core stability. Exercise 4, Seated High Knee Hip Flexion March. Primary objective, fortify hip flexors and augment core stability to facilitate leg elevation during ambulation stair navigation and obstacle negotiation. Anatomical emphasis. This primarily engages the hip flexors, particularly the iliopsoas and rectus femoris, and necessitates profound activation of the abdominal muscles, such as the transverse abdominis, to maintain pelvic stability and prevent lumbar hyperextension. Biomechanical advantages. Robust hip flexors are essential for a proper gait and ensure sufficient ground clearance to decrease the danger of tripping. Enhanced core stability contributes to improved balance and posture, facilitating safer and more effortless execution of daily activities such as entering a vehicle or ascending stairs. Instructions for execution. 1. Position yourself at the edge of a robust chair, maintaining a neutral spine and keeping your feet flat and hip-width apart. Hands may rest on the thighs or gently grasp the chair. 2. Exhale. Activate your core and gradually elevate one leg toward your chest as high as possible without curving your back or leaning backward. 3. Maintain pressure on the top for 1 to 2 seconds. 4. Inhale while descending the foot with precision. 5. Alternate legs in a deliberate marching rhythm. Recommendation 2 to 3 sets of 10 to 15 repetitions per leg. Allow a rest period of 30 to 60 seconds between sets. If balance is a concern while seated, maintain both hands on the edges of the chair for enhanced safety. Frequent errors and their rectifications. Leaning backward. This technique utilizes momentum and redistributes effort from the hip flexors, perhaps placing strain on the lower back. Correction. Maintain a stationary and erect torso. Position a hand on your lower belly to assess core engagement. Allowing the foot to descend abruptly negates the advantages of the slow lowering phase. Adjust your foot downward delicately as though positioning it upon a delicate object. Advancements and alterations. Simplified. Elevate the knee to a reduced height. Emphasize deliberate motion. Minimize the frequency of repetitions. More challenging, decrease the tempo particularly during the eccentric phase. Elevate the foot slightly above the floor between repetitions or incorporate a little ankle weight after controlled movement is achieved. Additionally, you may execute a brief hold at the apex for 5 to 10 seconds. Practical advice. If elevating the knee is challenging, attempt to raise the knee while maintaining a flexed foot, envisioning the knee being drawn to a position midway between the chair and the chest. The quality of movement is more significant than height. Exercise 5. Transition from sitting to standing. Primary objective, develop functional strength in the lower body through the execution of a fundamental daily movement. Anatomical focus. This compound movement engages the quadriceps for knee extension, the gluteus maximus for hip extension, the hamstrings as auxiliary muscles, core muscles for trunk stability, and the calves for ankle support. Biomechanical advantages. The sit-to-stand exercise specifically enhances the coordination and strength required for independent transitions from a chair, toilet, or bed. Concentrating on a gradual, controlled fall enhances eccentric strength, facilitating a seated position without abrupt contact, so minimizing stress on the spine and knees. Enhanced sit-to-stand capability is significantly associated with reduced fall risk and improved overall mobility in elderly individuals. Instructions for execution. 1. Position yourself at the front edge of a stable chair. You may secure it against a wall for further stability. Feet should be positioned level and approximately hip width, apart gently retracted, so they are just below the knees. 2. Fold your arms over your chest to inhibit their use for pushing. Alternatively, if support is necessary, lightly rest your hands on the seat or your thighs, but strive to minimize their usage progressively. 3. Incline slightly at the hips. Maintain a straight back, Activate your core and exert pressure evenly through your entire foot. Elevate your hips upward and forward to achieve a complete standing position, contracting your glutes at the apex. 4. To sit, retract your hips as though extending towards the chair. Maintain an erect posture and flex your knees. Descend gradually and with precision until you are seated. 5. Reiterate in a regulated, uninterrupted manner. Recommendation: 2 to 3 sets of 8 to 12 repetitions. Allow a rest period of 60 to 90 seconds between sets. If this becomes excessively difficult, commence with fewer repetitions and increased rest intervals. Frequent errors and their rectifications. Utilizing momentum or arm strength. Engaging in rocking, exerting force with the arms, or creating motion diminishes reliance on leg effort. Commence with the legs and glutes. Employ the arms minimally and diminish dependence progressively. Inward knee collapse. Knee valgus during movement indicates weak hip abductors and places stress on the knee. Correction: ensure your knees are aligned with the second toe. A resistance band positioned around the thighs just above the knees can prompt you to externally rotate the knees. Sitting down abruptly, allowing oneself to sink into the chair, neglects the opportunity to develop eccentric strength and may jolt the joints. Gradually descend over a duration of 3 to 4 seconds, envisioning a hover just above the seat prior to landing. Advancements and alterations. Simplified. Utilize a taller chair or place a sturdy cushion on the seat to minimize the range of motion. Utilize hands for more support at the outset. More challenging. Decelerate the descent further, maintain a small weight at the chest once form is established, or attempt to softly tap the chair box squat without fully sitting down. To increase difficulty, once proficient, execute sit to stands from a lower seat or pause for 2-3 seconds in the standing position prior to resuming a seated posture. Practical advice. If stability is an issue, position the chair against a wall or maintain a secure surface within arm's reach to support yourself if necessary. Engaging in practice with a caregiver or partner present is a prudent safety measure for individuals at elevated risk of falls. Exercise 6. Seated hamstring stretch. Primary objective: enhance hamstring flexibility to alleviate pressure behind the knee and augment lower body mobility. Anatomical focus. This targets the hamstring's biceps, femoris semitendinosus, and semimembranosus, which frequently exhibit tightness, particularly in individuals with sedentary lifestyles. Biomechanical advantages. Taut hamstrings can exert tension on the shin-elevating knee stress, especially at the patellofemoral joint, where the patella articulates with the femur. They can also retrovert the pelvis, so flattening the lumbar region and exacerbating back pain. Extending the hamstrings facilitates pelvic alignment, alleviates strain at the posterior knee, and enhances walking gait. Stretching complements the strengthening workouts performed. Instructions for execution. 1. Position yourself on the front edge of a robust chair. 2. Extend one leg forward with the heel resting on the floor and the toes directed upward. Maintain the opposite foot flat as the knee is flexed. 3. Assume an upright posture with an elevated chest. Flex at the hips, avoiding spinal rounding until a gentle to moderate stretch is perceived along the posterior of the extended thigh. 4. Maintain the position for 20 to 30 seconds, inhaling deeply and easing into the stretch. It should evoke a sensation of gentle tension rather than acute agony. 5. Gradually resume an upright position, then alternate legs and repeat the process. Prescription: 2 to 3 sets of 20-30 second holds per leg. Execute stretches subsequent to the strengthening workouts or later in the day when the muscles are adequately warmed. Frequent errors and their rectifications. Rounding the back. Extending the head and shoulders shifts the stretch to the lower back instead of the hamstrings. Correction. Maintain an elongated spine and hinge at the hips, envisioning the movement of your chest towards your thigh. Bouncing ballistic stretching may induce reflexive muscle tightening and provide a danger of micro tears. Adjust. Extend softly and maintain a consistent static posture. Forcing the stretch, engaging in painful exertion may result in harm. Correction. Cease at a state of comfortable tension and strive for incremental progress over time. Advancements and alterations. Simplified minimize forward hinging and permit a slight flexion in the knee of the extended leg. More challenging. Lean slightly further forward while maintaining a straight back, ceasing if discomfort arises. One may extend the hold time to 45 seconds if deemed comfortable. Practical advice. Utilize a yoga strap or a towel encircled around the foot if accessing the toes proves challenging. It aids in preserving an elongated spine while achieving an effective stretch. Assembling the routine. A typical session for an individual with intermediate fitness and no significant medical limitations may appear like follows. Warm up, 5 minutes of mild seated marching and ankle rotations. Strength training. Seated knee extensions. 2 sets, soleus heel, raises 2 sets. Pillow squeezes. 2 sets seated high knees, 2 sets. Functional exercise. Sit to stand, 2 sets. Flexibility. Seated hamstring stretch, 2 holds for each leg. Overall duration 15 to 25 minutes contingent upon rest periods. Frequency target 3 to 5 sessions weekly. On alternating days, you may incorporate light walking or simple balance exercises if you feel comfortable. Consistency is paramount above intensity. Advancement over an 8-week period illustration. Weeks 1 to 2. 1 set of each exercise emphasizing technique and respiration. Weeks 3 to 4. Elevate to 2 sets, incorporating an additional 2 to 4 repetitions each set as feasible. Weeks 5 to 6. Augment repetitions to approach the top limit of the prescription, or use minor weights, ankle or lat for progressive overload. Weeks 7 to 8. Incorporate a 3rd set if feasible and explore slower eccentric periods lowering to enhance control. Assessing advancement and establishing objectives. Monitoring little objective alterations aids in sustaining motivation. Implement uncomplicated strategies that can be executed bi-weekly. Duration needed to execute a sit-to-stand set of 5 or 10 repetitions. Count of knee extension or heel lift repetitions prior to tiredness. The distance one may maintain when transitioning from a seated position to a standing position relative to a lower or higher seat. Self-assessed pain ratings during activity and at rest on a 0-10 scale. Assurance in traversing brief distances or ascending a single flight of steps. Establish pragmatic, significant objectives. Rise from a standard toilet unaided or walk to the mailbox and return without pausing. Acknowledge minor achievements. Less discomfort while descending stairs or adhering to the program thrice weekly for a month. Safety cessation indicators and warning signs. Chair-based activities are low risk. Nonetheless, certain circumstances necessitate further caution or physician approval. Recent surgical procedures including joint replacement, recent deep vein thrombosis, DVT, uncontrolled hypertension, and unstable cardiac conditions. See a healthcare professional prior to initiation. If you encounter abrupt swelling, acute joint pain, numbness, tingling, dizziness, chest pain, or syncope when exercising, cease activity immediately and obtain medical assistance. Individuals on anticoagulant therapy or with unmanaged hypertension should consult a clinician regarding isometric holds, such as prolonged strong contractions. Adhere to the stepwise program provided by the surgeon or physiotherapist following total knee replacement. Numerous exercises are suitable but may require adjustments in time and variation. Adjustments for prevalent conditions. Osteoarthritis. Engage in activities within pain-free limits. Mild soreness post-exercise that resolves within 24 hours is often acceptable, but ongoing pain or swelling indicates the need to decrease intensity or seek professional advice. Applying heat prior to exercise and ice subsequently can aid in symptom management. Knee replacement. Initial stages emphasize range of motion and modest quadriceps activity. Knee extensions and hamstring stretches are frequently employed, but adhere to post-operative protocols. Balance impairment or cognitive difficulties. Ensure the presence of a caregiver or therapist during initial sessions. Position the chair against a wall to eliminate tripping hazards. Utilize a chair with armrests if necessary for incremental advancement. Exhaustion or less vitality. Decrease sets, reduce repetitions, or perform the regimen in shorter intervals throughout the day, for instance 2 10-minute sessions. Pragmatic strategies for achievement. Select the appropriate chair. Opt for a robust stationary chair devoid of arms for expedited progress. Utilize an armchair if more support is necessary. The seat height must enable the feet to rest flat on the floor. Footwear is essential. Utilize solid, comfortable shoes, featuring a non-slip sole. Refrain from using slippery socks on hard surfaces. Environment. Maintain an unobstructed area surrounding the chair, keep a glass of water accessible, and offer adequate illumination. Consistency supersedes intensity. Engaging in brief regular sessions is preferable to infrequent, prolonged efforts. Associate the workout with a daily ritual. Perform the practice subsequent to brushing your teeth or after enjoying a morning cup of tea to establish consistency. Document progress. Utilize a calendar application or notebook to monitor sessions repetitions and any symptoms. Diagnosing frequent issues. I experience pain in my knees during knee extensions. Limit the range of motion and refrain from achieving full extension. Place a pillow beneath the thigh to alter the angle and assess the footwear and foot positioning. I am unable to elevate my knee significantly. Concentrate on minor controlled elevations and increase repetitions as control enhances. Simultaneously enhancing the hip flexors and core will be beneficial. I experience instability while standing. Position the chair against a wall for sit-to-stand transitions, utilize the chair arms initially, and engage in deliberate controlled descents. Focus on enhancing ankle and calf strength and balance progressions once proficiency is achieved. I lack motivation. Correlate exercise with pleasurable activities, engage a friend or family member, establish small, quantifiable objectives, and acknowledge achievements. Collaborating with a specialist. A physiotherapist or exercise specialist is capable of customize the regimen to align with your own medical history and objectives. Instruct on proper technique and provide tactile feedback. Advance the program cautiously and incorporate supplementary balance or ambulation training. Offer clarification regarding the distinction between typical discomfort and alarming pain. Numerous clinics provide group lessons for seniors that utilize chairs for support. Social engagement frequently enhances compliance. A commentary on discomfort and physical activity. Experiencing some soreness during strengthening is typical, particularly when initiating a new regimen. Acute piercing pain, quick edema, or a continuous exacerbation of discomfort over several days are indicators to cease activity and consult a physician. In cases of chronic knee osteoarthritis, fortifying the muscles that stabilize the knee frequently alleviates pain over a span of weeks to months. Early workouts may be arduous, but can result in diminished discomfort in daily activities. And there you have it, 6 simple chair exercises that can truly make a difference for your knees and legs after 60. Remember, it's not about pushing yourself too hard, but about moving a little every day with care and consistency. Just 15 to 20 minutes daily can ease pain, rebuild muscle strength, and help you walk, stand, and live with greater confidence. Your chair can become your best tool for independence, a small step toward a stronger, more active life. Stay patient, listen to your body, and celebrate every bit of progress you make along the way. If you enjoyed this video, please give it a thumbs up, share it with friends or loved ones who might benefit, and subscribe to the channel for more simple, senior-friendly exercises like this one. Thank you for watching and take good care of yourself. Stay strong, stay positive, and may your days be filled with energy, movement, and good health. See you in the next video. Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement.